Guttate psoriasis, a small discoid shaped lesions will be coming. The most important feature of scaling is also present in these both type of psoriasis. That is a guttate psoriasis. Coming to the pustular psoriasis, as the word suggests, there is a pustular psoriasis. Now, next is the inverse psoriasis. Inverse psoriasis means psoriasis is most commonly present in the extensor aspects. Sometimes it may present in the flexure aspects also. So those psoriasis are considered as inverse psoriasis. And the last one, that is erythrodermatous psoriasis. And this is a very rare variety, and it's very difficult one to manage as well, because it will affect the whole body. Whole body lesions will be present. Severe amount of scaling will be present with the utmost itching and pain will be present. So these are the modern varieties of the psoriasis. Apart from this, we have got, based upon the location of the disease, we used it to diagnose it as a scalp psoriasis or palmoplantar psoriasis, etc., etc., is also present. So in this way, we are little more familiar with the modern diagnosis of the psoriasis. Okay, but when come to the clinics, pictures which we have seen may not be coming in the clinical practice. When we come to the clinical practice, this way with the presentation. Another presentation is like this. Another presentation like this.
Some voice is coming.
Okay. So these are some of the lesions or some of the cases which are occurring in our community. When we look at these kind of pictures, it's very difficult to diagnose whether it is a plaque psoriasis or
some disturbance are coming.
Psoriasis.
So some voice, some disturbance is coming from.
Hello.
Yes, sir. Some.
Yes. Is it audible now? Is it clear now? The sound? Yes. Okay. Thank you. So we will continue. So when it comes to the clinic, these are some of the presentations or some of the cases which I have got in my clinic. It is not easy to diagnose whether it is a pustular or plaque or whatever it is. Sometimes a mix-up of the cases also will come into the OPD. So in this present situation, there lies the importance of diagnosing in another way or another pattern which we used to know, which we have studied in our colleges and our basics. Okay, so let us try to diagnose in such a way so that we can diagnose it through Ayurveda. So these, when we coming to the diagnosis part, these are in modern science, we may diagnose in these all ways. When coming to the Ayurveda, we used to diagnose it as Sigma Kushta, Ega Kushta, Kidiva Kushta. See, I mean, seasonal changes, region-wise changes are there while diagnosing the psoriasis cases. I admit that also. So these are the common diagnosis which we used to make when we are sitting in our OPD through Ayurveda. So, but there also, hardly we are not having such drugs which are directly indicated for Sigma Kushta or Kidiva Kushta. Most of the drugs, when it comes to the indications, it is indicated for Kushta, generally Kushta or Kandu. Like that only we are having the indications. So when we study in our basics or in the classics or the medicines which we have studied in our colleges, it is not easy to practice psoriasis with those kind of indications. So probably we all doctors will be depending upon the seniors or the professors or the suggestions given by the various doctors or practitioners. This is good for that kind of conditions, or this particular medicine is good for that condition. This is what we are following. Okay, so there is no literature to find out what is the best medicine to be suitable for this particular condition. So in this session, I am trying to convey the idea which I am following for diagnosing such cases and for practice, and the results which I am getting. So psoriasis, and the tool which I am using for diagnosing this condition is a dosha, the basics which we have studied in our colleges, dosha analysis, and how I am selecting the medicines in this type of cases. Now, before starting that, we must know what is meant by psoriasis, because we are having certain dilemmas that the diagnosis is multiple diagnoses can come when we look through the Ayurveda. So there is a situation that we must analyze the situation, and accordingly we should find out which condition or which is the present situation. So for that purpose only, I'm just going through this basics of the pathology of psoriasis. So psoriasis is an immune-mediated inflammatory condition that we all know. See, due to the external factors, what happens? The skin is getting irritated, and the immunity response will start very soon. So due to that, the hyperactivity of the T cells is happening, and due to this thing, there is a normal inflammatory process is happening in our body. Here, it is in a deregulated fashion. It will happen. The inflammation will happen. So the production of cytokines will be pro-inflammatory cytokines will be overproduced, and at the same time, there will be blood vessels will get dilated, and vascular engorgement will happen. So what is a problem? Hyperplasia of the cells will happen, or the cells will get immature or improper cell maturing or maturation will happen in the body. So as a result of this, the cells will get dead very fastly. And as we all know, the nourishment for the cell is the fatty tissues. That's what the sebum or the fatty tissues are producing, or fat is getting produced inside of the body in a normal basis to get the nourishment for the skin. What happens here means the fat is not get released on the adequately. So eventually what will happen? The dryness of the skin and the scaling will start. And this will goes on increase, and this process will get repeated and repeated. And this is how this particular psoriasis is getting formed inside of the body. Now, if you can see the histopathology, it's a representation only. You can see the heap of scales or the skins which have produced upon the epidermis. Okay, so in this way, the dilatation of the papillary vessels is happening. You can see that, and increased number of Langerhans. So the immunity is getting sensitized. So due to this particular thing, the psoriasis, disease psoriasis is getting happen inside the body. So in which all ways we are diagnosing these cases. These are the main criteria. If somebody is not knowing that, or if you are a beginner, if somebody is listening this program, if you are a beginner, just please note it down. These are the important signs which we used in our clinics to find out whether or to diagnose the psoriasis. First one is a candle grease sign. So this is candle grease sign means, I will show the picture later. Candle grease, everybody knows. If we are scraping the candle, you will get a layer of wax, isn't it? So that is called as candle grease sign, a small waxy gray plaque-like lesions we can scrap from the body. Next one is auspit sign. Auspit signs means if you are peeling this kind of scales, you can see a minute bleeding spots beneath the scales. That is called as auspit sign. Now, next is a Corbinus phenomena. This particular phenomena you can see in lichen planus also, if you remember that. What is Corbinus phenomena? If there is an injury in the body, suddenly the disease which have already gone from our body, it will start based upon this injury or based upon this injury mark or watch it over the microscope, you will find out the difference which is happening in this particular skin lesions. Now, this is called as candle grease sign. This is a case which I have got in my OPD, and there you can see the candle. If you can easily scrap it out just like a candle. This is called as candle grease sign. In almost all the cases, this feature you will get in the case of psoriasis, especially in the case of plaque psoriasis. Now, next, this one is the auspit sign. If you scrap the scales, you will find a small bleeding spot. This is a bit larger one. So for the namesake, I have put a picture only, but it will be very minute bleeding spots. Sometimes the blood will not come out, just a bleeding spot you can see beneath the scales. That is the auspit sign. Now, next, this is a Cogner phenomena. See, the person is having there is a wound or there is a scar mark is there. Upon this scar mark, in a linear fashion or whichever way the scar is present, upon these lesions or on the scar mark, the lesions will come again. This is called as Cogner phenomena. Now, this is a histopathology. I have placed a sample here, and you can see what the epidermis, how the epidermis has been destroyed in the right side picture, where you can see the cells are all got distorted from the document the PASI score, which is based upon the surface area.
Some
the how
network
much
issue has happened actually for last 30-40 seconds. Yeah, 30 seconds.
Okay, thank you. Is it clear now?
Yeah, sir. Yeah, please.
Is it okay now?
Yeah, please.
Okay. So I was discussing about the histopathology. In the histopathology, you can see what all are the changes which will happen. In our, you can clearly see the epidermis. The topmost part of the skin is getting destroyed due to this particular disease. So in this way also we can diagnose. Even if it is not possible in OPD, you can send the specimen to the any laboratory and you can find it out whether you can confirm the disease it has a psoriasis. Now coming to the documentation part, this histopathology is a very good criteria. Another one is the PASI score, which is going to assess the how much surface area is got affected in this particular patient due to this disease. So this is a scale which is using. It's a tool which is available in the internet. Also, there is a calculator is available. Just note down the area as per your assessment, how much area is got affected, how much thickening is there, how much erythema is there. Based upon that, you will get a score, PASI score, which is a very genuine data which can be used for the documentation purpose. Okay. Now, next is selection of medicine. Based upon, we have now studied how to diagnose a particular case, but how to select a medicine based upon, see, while coming to the selection of the medicine, we cannot practice in the modern medicine. Yes, obviously in certain areas of our country, you can practice on modern medicine, but the principle or the duty of the Ayurvedic physician is to practice through Ayurveda itself. Okay, so wherever it is necessary, you can refer that particular patient to the modern. So you need to diagnose a particular case and have to select a medicine for treating through Ayurveda. So in such condition, we will get dilemma. So how to select a medicine? So before that, we should understand how to diagnose through Ayurveda. As I've mentioned, Sitma Kushta is there, Eka Kushta is there, Kitipa Kushta is there, some kind of palmoplantar psoriasis, Vibhadika also is there. First, we will go through the theoretical knowledge of the Sitma. See, this is the quotation which is coming from Charak Samhita, Parusha, Arunani, Vishirna, Bahi, Snigdhani, Shukla Rektava Basani, Bahuni, Alpa Vedanani. So these are the features which are explaining by the Charagacharya. You can see the picture. See here, you can see that beneath there is a Rekta Varna is there, scaling is present, Alpa Kandu will be there, Alpa Vedana will be there, and it is Alabu Pushpa Sangasha is there. So based upon all these criteria, we can diagnose it as a Sitma Kushta. Okay. But in certain cases, sometimes Asvedana, Mahavastu, Malsya Shagalobhavam Tadeka Kushta. Sometimes this kind of scaling lesions may consider it as a Malsya Shagala. Later, in the previous slides, we have seen the what you can say, candle grease sign. So there you can easily see it's like a Malsya Shagalobhavam. So that's why certain practitioners are diagnosing it as Eka Kushta. When it comes to Kitipa, what is that? Shavam, Kinakara Sparsham, Parisham, Kitibam Spradam. This is more correlatable with the lichen planus, but still there are certain psoriatic cases where the Kitipa Kushta, where it is similar to the Kitipa Kushta. So there, certain practitioners used to diagnose as Kitipa. And the final one is a Vibhadika. As we all know, you have palmoplantar psoriasis, severe scaling will be present, severe lesions will be present in the palms as well as the soles of the foot. There you can diagnose it as a Vibhadika. But the thing is, even if we are diagnosed as Sitma, Eka Kushta, Kitipa or Vibhadika, we don't have much medicines which is directly indicated to these kind of diseases. So the diagnosis in this fashion is quite more important for the academy purpose. So as a practitioner, this particular percentage is intended for the practitioners only. So for practice purposes, this kind of diagnosis is only good for documentation purpose. Okay. So coming to the practice, you should analyze these kind of symptoms, and there should be another way to diagnose and to select the medicines. So let us do an exercise. So these are the expected or which you can see in the case of psoriasis. Scaling will be present, pruritus, erythema, so etc. etc. These are the symptoms. Just try to analyze which dosha is present or due to which dosha this particular symptoms are happening in the body. If we can do that, then we will get a clear picture of what is the dosha present in this particular disease. See, one more interesting thing is there. When you get a psoriasis case, Don't expect that it will be always Vata Kabaja, always Kabavita, always Pitta Kaba. As the treatment progresses, the condition may change. So suddenly what we have to do, we have to change the medicine. Otherwise, if you're continuing with the same medicine, if you're fixing it as a, say, if you're fixing it as a Patoladi Kashaya or Manjishtadi Kashaya, from the beginning to the end, if you are following the same medicine, sometimes you will be in a dilemma that this particular disease is not getting subsided fully. And we will blame the disease that this is a relapsing nature, or this particular disease is having a relapsing nature. That's why we are not getting much research. But in fact, if you can change the medicine as per the condition or the situation, you will get good results. So my dear doctors, instead of taking it as a lecture session, if we can participate in this particular analysis, that would be a very good interaction. Say, for example, in the case of scaling, what will be the dosha if you are getting a patient with the scaling? Somebody can message, that will be fine. If you can open the chat box and you can message, what will be the dosha in the case of scaling? Yes, exactly, correct, doctor. Scaling is exactly, it is a Vata dosha, Vata predominant. Can you say next one, pruritus? Somebody else, pruritus?
Kapha dosha.
Yes, correct. Kapha dosha. Pruritus is a kapha pradhana. From before getting into the other details, can you say that from where this kind of analysis can be done? From where this kind of analysis, it's not from Kushta Chikitsa or Kushta Nidana, it's not coming from there. It is coming from our basics, that is Sutrasthana, Charaka Sutrasthana or Ashtangridaya or Susruta. Whatever text you are familiar with, that can be followed. Ashtangridaya or Charaka will be the better choice for selecting. From where, from in that Samhita in Sutrasthana also, from where Dosha Adi Vijnaniya, Dosha Dushti Lakshanas are there, Dosha Vriddhi Kshaya Lakshanas are there. From there, you should pick it out. Which all are the symptoms, what all are the doshas which are getting aggravated. So that should be the line. So don't worry if you are a beginner in this particular case. Don't worry about that. Don't get hesitated. Just go through keep the textbook along with beside in your OPD. You can refer the textbook and find out which is the dosha. And in fact, various artificial intelligence supported even softwares are available or making available. Even Vaidyanathan is also working behind that. Such kind of softwares may be present, so then it will be easy. So if you can put it out, you can find it out which dosha gopa is there. Now, pruritus, that is kapha dosha, as doctor told, it is kapha dosha, but there is a slight confusion in that also. If you can go through the pitta koba lakshanas or pitta vriddhi lakshanas, there also you can see the same kandu. Okay, so the kandu can happen predominantly due to kapha dosha, but in some occasions, it may happen due to the pitta dosha also. Say, for example, in the places where it is more hot region, there you will get, or the kandu is probably due to pitta dosha. So considering kapha dosha, if you are giving the kapha shamana drugs, sometimes you will not get results. At that time, you can find it as an ajubhishaya and you can shift over to the pitta shamana drugs. Definitely, you will get the result. Okay, so in this way, if you can do the dosha analysis, it's going to help your clinical practice. Now, next is erythema. Can you say which dosha will be present in erythema?
Pitta dosha.
Definitely, doctor. It is pitta pradhana itself. Now, next is hyperpigmentation. There is blackish discoloration. Blackish discoloration will be due to which dosha?
Vata dosha.
Exactly. Very good. Vata dosha is the one. Next one is dryness. Obviously, what will be the dosha? Vata itself. Correct. I'm very happy that more doctors are getting participated in this session. That is very good. Next is the plaques. Plaques means thickness. So which will be the dosha?
Kapha.
Yes, Kaba is the main. In the case of thickness, it is Kaba. If it is always in the case of plaques, there will be dryness. That dryness is due to the Vata. So if dryness and thickness is there, definitely it is Kaba Vata or Vata Kapha. I hope it is clear now. Now, next is oozing. Oozing. What will be the dosha in the case of oozing?
Pitta.
Yes, exactly. Pitta is there. And at the same time, there is a chance for Kabha also. Pitta will be predominant, slight Kabha, because this oozing is happening due to an infection. Or else, if it is maybe due to the infection or slight inflammation will be there. So there, Kabha will be present. Now, next is swelling. Swelling will be due to?
Kapha.
Yes, exactly. Kabha dosha. Now, next is pustules. If there is a pustule, then
Pitta kapha.
exactly, pitta, and associated with that, kapha will be present. Okay. Now, coming to the wounds, sometimes joints will be affected with the wounds. In the case of psoriasis, which will be the dosha? Pitta. If pain is there, Mostly in the case of
Vata.
wounds, there will be vein, then
Vata.
pitta, vata. Yes, exactly. Then burning sensation. What will be the dosha?
Pitta.
Pitta
Pitta.
dosha.
Pitta dosha.
Yes, yes. Now, final one, that is joint stiffness and pain. As you all know, as the
Vata.
psoriasis progress,
Kapha and Vata. Kapha
yeah,
and
exactly.
Vata.
Exactly. Kapha and vata. Exactly. Very good. Now, when the joint stiffness and pain is happening as a progressive stage, psoriatic arthritis, when it comes, definitely there will be joint stiffness and pain. There, you should diagnose in this way. So this was a little exercise, and I think it is clear to everyone now. So these are the expected symptoms. In this way, depending upon the severity, depending upon the degree of the symptoms, you can easily diagnose it as which dosha is predominant in the case which is present in front of you. Now, can you diagnose this one? I mean, this is a psoriasis case, that's not needed based upon the dosha. Severe pain is also there in the case of this particular pain is there, joint involvement is there.
वात प्रधान कफ
Vata. Vata.
वात प्रधान पित्त
Vata.
Okay, okay,
Redness है तो पित्त भी है साथ में वात पित्त है.
okay, okay.
Pitta
Okay,
Pradhan
so the,
dosha.
yes, this is the exact diagnosis. That is a pitta kabaja. See, when I told that it is a pain, there is a pain, then suddenly we will shift to the vata. Actually speaking, this particular pain is told by this particular patient, but that pain is due to the excessive pitta. Okay, daha also can be considered as a pain. Daha in an extensive fashion, they will tell it as a pain. They will tell that severe burning sensations and it will feel as a pain. So in that sense, only the patient is telling it as pain. So vata is not predominant there, pitta itself. Okay, and there is a kaba because you can see the scale, whitish scales are there. So you can diagnose it as a pitta kabaja condition, pitta predominant. Okay. Now, can you diagnose this one? Scaling is there. There's no burning sensation.
Vata
Vata
Pitta.
वात
Pitta, sir.
वात प्रधान है इसमें वात है.
कफ प्रधान पित्त
Exactly. Kapha Pradhana Pitta. Don't worry, other doctors, if you are mentioning, if you are diagnosing it as wrongly, there is no issue. Because for a beginner, not only for beginner, as an expert also, sometimes it may get failed, no issues. If you are keeping practice on this, you will get the final answer. And we have got a leverage that how there is Upashaya and Anupashaya for us. If you are diagnosing it as wrongly and you are selecting a wrong medicine, definitely within 2 or 3 days, you will get the false result. So immediately shift to the other one. No issues. And sometimes if this is in a Kapha Pitta stage, after 1 week or after 2 weeks, it may shift to the Kevala Pitta or Kabaja or Kabavadaja. So there, another set of medicine should be selected. That's a process. So don't worry about it. So this is a Kapha Pradhana Pitta because scaling is more, whitish is more. Inside that, beneath that, there is a Pitta Dushti. So that's why it is Kapha Pradhana Pitta Dushti. Now, can you diagnose this one? There is no much redness. Erythema is not that much present.
Kapha Vata, sir. Kapha Vata,
There is no
sir.
thickness is not that much present.
वात प्रधान कफ.
Vata
Yes.
Pradhana Kapha.
Yes,
Vata
yes.
Kapha.
Yes, exactly. Vata is more because there is not much thickness. Severe dryness, you can see small scales it is falling. If it was large, then we can say that it is a kapha due to kapha dosha. So here it is vata kabaja. Okay. Now, can you diagnose this one?
पित्त कफ.
Vata Pitta.
पित्त प्रधान.
पित्त प्रधान कफ
पित्त प्रधान वाता. वात प्रधान पित्त.
Pitta Kapha.
Yes, vata pradhana pitta. So this is the diagnosis of this particular case. Why it is happening means this is vata. Why I have not mentioned about the symptom. Here the patient is having severe pain due to the pitta pradhana. I mean, pitta is there at the same time severe pain is also telling. You can see that there is not severe redness is there. Instead, severe scaling is there. Severe dryness is there. That's why vata became predominant here. Pitta is also equally important. We cannot say that Pitta is less. Pitta is also equally important. Okay, so that's why it is Vata Pitta. Can you diagnose this one in a modern way? What will be the psoriasis? This one in a modern way.
exfoliative psoriasis
Exfoliative or
psoriasis
else or else erythrodermic psoriasis.
Purpural.
And this is the
Erythrodermic.
erythrodermic psoriasis, which we have seen in the first slide. Okay, severe. The whole body will get affected. And this is very rarely happening. And it is not easy to manage. But either through Ayurveda or modern or through modern, it's not easy to manage. But this was a case which I have got. Rarely I've got a case like this, and I've got a good result also. I will show the post pictures of this particular case. Okay, now can you diagnose this one? I mean, multiple patients are there, multiple pictures are there, not the same patient, but still.
Vata.
Vat
Pradhana.
Yes.
Vata
It is Kapha Pradhana Vata. Kapha Vata. Why? Because thickness is more. You can see the blackish discoloration, dryness is there, but thickness is more. That's why Kapha is more in Kapha Vata. Okay. Now, can you diagnose this one?
Pittaj.
Pitta Pradhana Vata.
Exactly. Correct. Pitta is more here. It is clearly visible and is Pitta Pradhana Vata. So Pitta Vata. So I think this exercise has worked. I think at least a few of the doctors could easily diagnose it as or correctly diagnose it as in the dosha. Now, next is the drugs of choice. If you are diagnosing in this fashion, how we can diagnose? How we can select the drugs? I have placed on 3 kalpanas here: kashayas, thailas, and gudha. Why? Because gudigas is not needed. It's not like that. Gudigas, we have not much confusions. Okay. So all those things we are familiar. What all are the actions? But in the case of kashayas, thailas, and kridas, certain confusions will be present. And most importantly, when coming to the northern part of our country, hopefully the doctors which are present in this particular presentation will be using little amount of kashayas. I hope so. So I think more stress should be given to the kashayas. Many of the doctors have shown their interest towards the kashayas also. We need to start the practice with kashayas. That's why I'm taking it as these drugs to choice, as a drugs of choice. Okay. Now, coming to the kashayas, these are the selection of the kashayas which can be done in the case of dosha dushtis, which we have mentioned earlier. If it is in the case of pitta kabaja, you can start with guluchyadi. If it is kaba pitta, you can select it as patoladi. If it is vata kabaja, you can select as guguludiktaka kashaya. Kaba vata, when you select the guguludiktaka kashaya, there is a problem in the guguludiktaka kashaya because the palladaka is an ingredient in the case of guguludiktaka kashaya. So you must ensure that if a patient is having a sensitivity to the skin, especially allergic reactions are there, then guguludiktaka is not a good choice. But I used to give it as a guguludiktaka kashaya devoid of this balladaka. Then we can take it as gugulu. That will be giving wonderful result. And mostly when most of the medicines which are marketed outside so are containing hardly bhalladaka. So because guguludiktaka will not produce any such reactions, very few patients we are getting such kind of reactions. If such a reaction is happening, you should withdraw that. Okay, so that is guguludiktaka. Then next is kabha vataja, that is aragodadikada kashaya. Then vada pittaja, manjishtadi kashaya will be good because there is a recta involvement. And next is pitta vada, there tiktaga kashaya is also good. Okay, now when it comes to the pitta predominance, pitta kaba or pitta vada, there is a special medicine which is available with the Vaidyaratnam also, that is Nishotamadi Kashaya. Nishotamadi Kashaya is, we will get a very wonderful result, especially in the case of oozing and all. If it is present, inflammation is present. In such conditions, Nishotamadi can be replaced with the Guluchyadi Kashaya. See, why I am telling about the Guluchyadi, everybody will be knowing what is a yoga. Guruji Padmagarishta Dhanyaka Rekta Chandanam, Pitta Sleshma Jwara Chardi, Daha Trishna Aknam Agnigrata. Pitta Sleshma Jwara Chardi, Daha Trishna Aknam Agnigrata. There is no Ushta which is indicated for Guluchyadi. Okay, but still Guluchyadi is a very good choice. And if you are starting with the Guluchyadi in this particular situation, you will get wonderful results. Why this is happening? Only because of the dosha samana. So I'm just emphasizing more on the dosha samana in the case of psoriasis or in the case of skin diseases, because this will work. So guluchyadi is a very simple drug, and even if the patient is reluctant to administer due to the palatability issues, you can go with the tablets also. That will also work. No issues. So start with the kashaya tablets itself. You will get the results. Okay. So these are the choice of the drugs in the case of dosha dushtis, which we have mentioned earlier. And as I told earlier, as a condition changes, the medicines also should be changed. Now, next is the Thaila. First stage, everybody will be going with the Brihad Dandapala Thaila, which is available with Vaidyanam. A few more drugs, Bakuji and Jyotishmati is also getting added into the Dandapala Thaila. There is a Brihad Dandapala Thaila, which is marketing by Vaidyanam. It is very good. I mean, when compared with the normal Dandapala, Brihad Dandapala is having a very good result also because of these ingredients. But there is a problem if you are applying directly Brihad Dandapala Thaila, because this is very potent drug. So especially in the case of Pitta Dushti is there, or Pitta Koba, or there is a chance. I'm not mentioning about the severe Pitta Koba. At least a slight Pitta predominance is there. Then Brihad Dandapala will produce certain issues. So in order to avoid that particular situation, Brihad Dandapala Thaila can be mixed with any other Pitta Samana Thailas. Say for example, Nalpamaradi Thaila, or else Neeli Daladi Thaila. Okay, so these can, or else Gobatmajadi Thaila, which is already mentioned here in this slide. So Nalpamaradi, Neeli Daladi, or Dinesha Valyadi, Dinesha Eladi. So that kind of Pitta Samana Thaila can be mixed with the Brihad Dandapala Thaila. Okay, or else another choice is to mix Grida itself. To use Grida as externally, not as internally. Grida can be used externally with the help of, as a mixture of Brihad Dandapala, Pitta Shamana drug, or Grida. Okay, for that you can select a Tikta Grida or Mahatikta Grida or Ayurveda Mahatikta anyway. So this will work in the case of excessive dryness or scaling is present in the case of psoriasis. Now that's the first stage. Now next is the second. Remember, when you use the Thaila, you should be sure that there is no amatva, there is no inflammation. If inflammations are there, then Thaila or Snigdha Prayoga is completely contraindicated. There you have to do the Rukshna therapy like Shalana or Avagaha. After that, you can change into the Thaila. Remember, without Snigdha Prayoga, the psoriasis will not get subsided. So Thaila or Snigdha is very, very important in the case of psoriasis. Now, next is the second stage. What I meant in the second stage means the inflammation is completely over, everything has subsided, only the scar mark is present. There you can adopt Brihad Dandapala Thaila mixed with any Varniyakara medicines. So Varniyakara medicines, a very good medicine which is available with Vaidyanam is Pancha Valkadi Yamaga. Pancha Valkadi Yamaga. This is very, very, very good medicine for getting the skin tone back and nourishment to the body. At the same time, it will prevent the further exposure or further relapsing nature of the psoriasis. So Panchavalkadi Yamaga is good, or else Eladi Kera Thaila is good, Eladi Yamaga is available, that is also good. So these are the choices which can be mixed with the Brihad Dandapala Thaila in the final stage of the second stage. Now, if severe Pitta Koba is there, if you want to do the Thaila Prayoga, as we have seen in the Vada Pittaja condition, there severe dryness is there. At the same time, it is in the beginning stage. It is ama is slightly present, but you have to use the Snigdha Prayoga. Then the selection is Gobatmajadi Kera Thaila. This is indicated for Visarpa. Okay, this will work very beautifully in the case of such conditions. So remember this medicine, Gobatmajadi Kera Thaila. Now, next is Grida. Now I have listed a lot of Gridas which is available with Vaidyanam also, and in fact certain drugs are available with Vaidyanam alone. That is Ayurveda Mahatikta Grida. Everybody knows that this Ayurveda Mahatikta, it is not Ayurveda the Gada. Ayurveda the Kashaya has been used, and along with that Mahatikta ingredients as Kalika. So this is how the Ayurveda Mahatikta Grida is preparing, and this is having a very good effect in the case of psoriasis, because Ayurveda has got a property as it's a Prabhava drug for all sort of skin diseases. So Kapha Shamana, it will work there, or Prabhava of Ayurveda will work here in the case of Ayurveda Mahatikta Grida. Now, Mahatikta and Tiktaga, as you all know, this is a severe Pitta Shamana drugs. Panchatiktaga. Panchatiktaga has got a property of Ama Pajana is there. Panchatiktaga. If you are suspecting a Amatwa in the body, Panchatikta Grida will be the ideal choice to get started. Now, next is Ugulidikta Grida. As we all know, it is a Asti Dhadu Gada or Majja Dhadu Gada action is present with Ugulidikta Grida. So, where it will be used, it has to be used in the case of psoriatic arthritis-like conditions. And if you can remember, Vata Kabaja case we have discussed. Previous slide was there a case I have shown you, Vata Kabaja. There the medicine, the choice of medicine was Ugulidikta Kashaya. In fact, this is if it is Vata predominant, whether it is advisable to go with Kashaya. Kashaya itself is Ruksha only. It is going to increase Vata again. So it's not an ideal choice. Even if you want to give the Google with the Kashaya, it should be given for 1 week only. Then you have to shift to the Google with the Grida or any sort of Gridas which are present here. This is going to work in the case of Kevala Vadaja or Vada Pradhana Vidoshaja conditions. Now, next is Kalyana Grida. This is also will be useful in the case of psoriasis. Why? Because Kalyana Grida has got an action at the manas level. Mano, or as we all know, there is a severe tensions or mental issues will be affected in the case of psoriatic patients. Unless and until if you are not addressing those issues, this disease is not going to subside. So Kalyana Grida in certain conditions, it may get work. I mean, we may use Kalyana Grida also. So these are the drugs of choice based upon the doshas. Along with this, remember the principles which should be applied. First of all, whether this is needed, Shamana or needed, or Shodhana is needed. That's upon the physician itself, depending upon how much dosha is present. If it is Bahu dosha, then Shodhana or IP treatment should be needed. Otherwise, Shamana is needed. Even if you are selecting a medicine, you must consider these kind of things. Otherwise, our medicines will not work. That is Agni, Ama, Koshta, Visha, Manas, and Ojas. This we have discussed in the previous classes also detailed discussed. So I am not repeating all those things again in this class. If we are having any doubts, we will discuss in the question answer session. Now, next is the Aushadha Karmas. If in certain occasions, if Kandu is more, sometimes some Prabhava drugs should be adopted there. Rekta Prasadana, Shobha Haratha, if more. You see, in all type of skin diseases, there is a Shobha Samprapti. So in such conditions, we may have to go with the Punarnavadi Kashaya or Pathya Punarnavadi Kashaya. Okay, or Vrikshadanyadi Kashaya, which is available with Vaidaratnam. So in such conditions, Shobha Haratha is needed. That should be adopted. Vishagna, as we all know, due to different kinds of toxins, these skin diseases are happening nowadays. So if you are suspecting a poison inside of the patients, you should definitely apply the principles of Vishagna. How it is possible? Yes, we have got drugs like Vilvadi Gutiga, Dushi Visharia Gutiga, or else if you are selecting Patoladi Kashaya itself is Pitta Shleshma Jora Chardi, Kapha Pitta Kushta Jora, Visham Vamim Arojaga Kamala. So it is directly indicated for Visha. Aragodadikana, it is directly indicated for Visha. So Vishagna principle should be adopted, or any such kind of medicine should be present in your prescription. Now, Ojaskara medicine like Arogya Vartinivati, Manaprasadana drugs like Manasamitra Vadaga. Recently, the Vaidaratnam has launched another medicine, another Thaila, that is Brahmi Thaila. See, this is very, the doctors are getting good results while applying Brahmi Thaila, or Panjaravinda Churna is there that can be given internally for improving the sleep. So all those stress-related issues also should be managed with our medicines. This also may be needed in the while managing the psoriasis. Now, next is the Varnya. As I mentioned earlier, Eladi or Panchavalkadi is also good for improving the Varna. Then Rasayana. As proprietary medicines, we are having Manipatra Guda as a Rasayana, Parogya Vartinivati is there, Gentaka Rasayana is there. So all those Rasayanas should be used as at the final stage of the management of this kind of conditions. Now, if you want to do the Shodhana therapy, so these are the therapies which are available. That is Snehapana, Vamana. Snehapana should be done. Then Vamana. Then the drugs which should be used for the Vamana is, which is mentioned in the Visarpahara, because in the Kushta, when you go to the Kushta, either Kushta or Visarpa, that Vamana drug can be used. Then again Snehapana and do the Virejana. If Vamana is not indicated for that particular patient, then you can directly go to the Virejana, or else Vamana is good because an immense amount of toxins will be present inside of the body, especially in the case of psoriasis. So Vamana is always good. Now, next is Takradhara. Takradhara is a specialized treatment which is adopted by, especially from the southern part of the country, that is from Kerala. It's a traditional way of practicing or treatment which is adopted in the case of psoriasis. Takradhara is a Shirodhara. Takra is the main ingredient, and along with that, Amalaki and Musta Kashaya also will be mixing up. And it is told to do it on the Shiras. But as a speciality of Ashtavedya tradition, we used to do it as a Sarvanga Takradhara also, because it is getting a good results in the case of psoriasis. Now, next is a Shashtiga Annaleva. Shashtiga means everybody know Shashtiga. That Shashtiga Pindasveda everybody know, isn't it? Instead of Pindasveda, we are using it as an Annaleva. Shashtiga is boiled and make it a paste and apply it over the skin. This is doing as a rasayana therapy externally. This will improve the complexion. This will improve the, it will provide a rejuvenation to the scaly lesions. It will produce a good snigdhata to the skins, so that the psoriasis will not come back. Okay, so the relapsing we can be arrested with this kind of treatment. In the case of scalp psoriasis, you can do the Sherolepa, or if needed, if more Rukshada is needed, probably you can do the Kayaseka with Arakuda Kashaya or Trabala Kashaya, etc. Now, the Rasayana part, apart from this Manipadragula, Gantaka Rasayana, etc., if you are interested, or if you are getting a very special case, you can go with the Tovaraga Rasayana, Ballaraga Rasayana, etc. That should be prepared by yourself. If you want to practice that kind of rasayana. So this is the brief Shodhana therapy which can be adopted in the case of psoriasis. Now the next one is Apatya. Within 2 or 3 slides we will finish. We'll wind up this session. Then we will go to the question answer session. These are the Apatyas and Apatyas. If you can take a screenshot of this particular slide, that will be good because this is very, very, very important. Unless and until if you are not advising the patients with the Patyas and Apatyas, this disease is not going to subside. Even if it gets subside, it may come back. Okay, so proper awareness should be given. Sometimes the patient will be ready to do all these things. The problem is maybe with we doctors. We are hesitated to give or to tell these kind of Apatyas to the patient. When you tell Apatya, it is our duty to tell what all are the Patyas. Okay, don't tell only the Apatyas. Then there lies the issue that the patient will feel that how क्या करेगा हम लोग कुछ भी खास नहीं सकता है तो ऐसा questions will आएगा. So definitely you should tell the Patyas also at the same time when you're telling Apatyas. Kaddomala levana vidahi ahara, dedi, kshira, kulatha, then non-vegetarian foods, uda, masha, tomato. Why tomato has been placed? Because it's not present inside our nidanas, which is mentioned by Charaka, Ashtanga, etc. Tomato is slightly sour in nature. That's why tomato has been included here. So in such cases, it should be avoided. And sour fruits. Then additional to the nidanas, which has been our Apatyas told by the Acharya, bakery items, chocolate. What is the main ingredient? That is maida. So this maida is producing amatva inside our body. And this is producing excessive dryness to the body. That's why maida should be avoided. And chocolate also sensitive to the patients. The next is fried food items. Then packed food items. Fried food items, as you all know, this amatva will increase. And packed food items, there are a lot of chemicals, including preservatives, coloring agents, etc., is present in the case of packed foods. So continuous usage of the packed food items is not going to work. It's not good for any sort of thing. Even if it is in the case of, not only in the case of psoriasis, for all the diseases, it's not good. Okay, then the liquor, smoking, pan, etc., all those things is going to produce a rectal dushtis, so it should be avoided. Coming to the Patya, Madhurya Rasahara is very good. Takra, it should not be so. Madhurya Takra, or that can be taken. Then vegetable rich diet. You can tell all the vegetables except the vegetables which are mentioned in the Apatyas. You should tell which all are the vegetables you can use depending upon your availability, depending upon your state, your locality. Okay, with fruits, then good water intake. It is very, very must, because the dryness, as we have seen the pathology of the psoriasis in the modern aspect, dryness is the main issue, or the fat is less, or the production of the fat is very less. How it can be replaced? Good water intake. That's very must. Okay. Now, when you think about the Patyas and Apatyas, Viharas are also very, very important. Probably we may miss that. So the Apatyas due to these things are the cosmetics. How it can be replaced? Natural cosmetic. Aloe vera can be suggested. Mental stresses will be there. How it can be addressed? Yoga, pranayama, etc. That can be practiced. So definitely the stress will be less. Extreme climates. So as part of the job, or maybe as part of your life status, you may be present in the extreme climates. So how it can be reduced to follow the Ritucharyas. Different Ritucharyas are there. We are all familiar with that. We have all studied, but how much we are implementing that into our practice? That's a question. So Ritucharya should be adopted based upon your state, your locality. The proper Charya can be adopted. Now, jobs exposing the chemicals. Definitely, this is a very challenging situation. We cannot say, we cannot advise. We can advise, we can suggest that this job is not suitable for him. But we cannot expect that the patient will quit that job. Okay, so within that job itself, try to find out what solutions, how to use, advise to use the gloves and all, the coats. So that can be advised. Then do Abhyanga or the medicated bath. There is a Siddhartha Snana Churna which is available with Vaidaranam. You can advise to the patient that this can be used for a bathing purpose. So it will improve the skin complexion, skin immunity, etc. So Abhyanga along with the medicated bath will work in that kind of conditions where due to the job, the chemicals, exposure to the chemicals are compromised. Now, next is a lesser sleep. Sometimes in or many of the cases, due to the overexposure to the social media, the sleep less sleep is happening. So you must advise that this is not good for your health. This is affecting your skin, not only your mind. This is affecting the skin. So you should keep educating the patient. So the patya and apatya viharas are also should be addressed in the case of psoriasis. So this is some of the pictures which are showing the results which we have obtained with the above said medicines and above said diagnosis. Okay, so this will work, no doubt about that. I think we are running out of time. I have placed 2 or 3 slides as an exercise to diagnose as well as to prescribe. If anybody can tell at least a kashaya, that will be good in this situation. Do you remember the dosha analysis? In this case I have already shown in the previous slides. It was Pitta Kapha Pradhana. Pitta Kapha Pradhana it was. Can you suggest a medicine for that?
Guduchadi Kashaya.
Exactly, Guduchadi Kashaya, or if you can go with the Nishotamadi
Patola Katurohina.
Patola Katirohina, what was the problem? Patola Katirohina is Kapha Pitta Samana. That is slightly different. Kapha Pitta Samana. So here Patoladi will not work.
Nishotamadi.
Yes, exactly, doctor. Nishotamadi Kashaya is going to work here. See the result. This is a case of erythrodermatic psoriasis. Now you can see the difference. Okay, this was an IP case only. That's why this much result has obtained within 1.5 months. Okay. Now, can you diagnose this one? Lesions are not that much clear. Not that much clear that I know. But if you can go through the joints. Yes, it is Vata Pradhana. It's a case of psoriatic arthritis. You can see the deformities on the joints. If you can see that. The starting of psoriatic arthritis. Okay. So only for that purpose, I have placed this slide or this picture. Here you can go with the Guguladitta Kashaya or Guguladitta Grida. And if needed, you can do the Basti also. In the case of if you are doing an IP management, this particular case. Okay. Now, can you diagnose this one?
Pitta Pradhan Kapha.
Yes, Pitta Pradhana. Previously, this was, yes, correct. This was the picture. The right side picture was the original one. Then and I advised to remove the hair to the patient in the next visit. When we remove the hair, you can clearly see the this pus is present. This is a pustula. This is a case of pustula psoriasis also. Okay, I have not shown any picture of pustula psoriasis. That's why I have placed this one. So Pitta Pradhana, Pitta Kapha Pradhana. There you can give the here actually speaking this equally. Kapha is also equally present here. So even if you are prescribing the Patoladi Gana Kashaya, that also will work here. Okay. If you are getting Anuvashaya, then only you need to shift to the Guluchadi or Nishotamadi here. Okay. Now, so with this, I'm finishing my session. Abhyasa Prapede Drishti Karma Siddhi Pragashni Ritna Salsat Jnanam Shastra Deva Chayade. We have got a lot of tools. We have got a lot of weapons with us. Only by practicing or with these kind of weapons, we will get a good result, or we will find out the best outcome with through the Ayurveda. So everybody must try that, and I'm wishing all the best to all the practitioners or the doctors, and I thank everyone to be patient, was patient by listening for 1 hour session. Thank you.